So, yeah,
Thank
so
you, sir.
we are discussing about the mastitis. Like here in this talk, we will try to cover what is the different diagnostic procedures of the mastitis, what is the treatment strategy when during the animal is suffering for already mastitis, how what is your approach and how will prevent the treatment, prevent the mastitis, and what is the management to reduce the incidence of mastitis in any organized or unorganized dairy herd. So here, if we define the mastitis, there are two things we have to make clear in our mind. First is the morphological characteristic of the adder. Number two is the physiochemical property. Morphological adder means changes of the adder means uniformity adder will not be there from the left adder or right adder, fore adder or hind quarter, fore quarter, hind quarter. Or there may be, if you examine the physical expression, there may be pain, heat, or redness. Number two, you have changes of the milk in this color, consistency. These are the different types of changes. What the whether milk is pass is there, blood is in milk. So based on these symptoms, we can diagnose that animal is suffering from the inflammatory. Then we will discuss about the different type of etiology and what are the various clinical signs based on the different pathogen-specific mastitis. Then what is the diagnostic procedure? What are the internal diagnostic procedure of mastitis recommended by International Dairy Federation? Then what are the different management aspects based on the environmental or contagious pathogen? So these are the things we will discuss by the step by step and what is the international recommendation for the different mastitis control program or what is the 5-point, 10-point mastitis control program are already outlined by the NMC or NIPR. Then we talked about the first topic to see the etiology of the mastitis. Mastitis is caused by multifactoriality because it's not caused by a single pathogen. It may be caused by the bacteria, fungi, virus, like that. But it has been seen that mastitis is mostly caused in more than 90% cases or 95% cases. Mastitis is caused by the bacteria. Then if we talk about bacteria, then we can categorize the bacteria in three categories. First is the contagious pathogen, number two is the environmental pathogen, number three is the miscellaneous pathogen. Contagious pathogens, what are the contagious pathogens? Contagious pathogens have been seen here, depicted here, that Staph aureus, Agalactia, and Mycoplasma. So why they are called the contagious pathogens? Because these type of pathogens already they remain available. These pathogens are already available or present in the cow's environment, nearby surface of the earth. But when the milkers or milking practice are adopted, then it will not protect properly the hygiene measure, then infected to this pathogen mostly transfer from infected water to healthy water. So that's why these are called the contagiousness pathogen, and these are mostly responsible for the subclinical mastitis. Then environmental pathogens, they are mostly Streptococcus group, then Escherichia, Klebsiella, Pseudomonas, like that. So these are called the environmental pathogens. These pathogens are not generally available in the cow's surface or udder. They are present, which are found in the cow's nearby environment. So when they get the opportunity, they enter into the mammary gland, the teeth follicles. So when they get the opportunity to enter, because when the cow remain cow just after support participation, or any cow is suffering from some immunosuppressor, not immunocompetent that parts. So in that case, this type of pathogens enter into the mammary gland and produce the teeth. Then miscellaneous pathogen, these are the pathogens which mastitis will occasionally, or they may infect only single quarter, or only a few animals are affected by the VIR. But if you see the Streptococcus or Escherichia coli, they generally produce the disease of mastitis in a large number of animals in the organized herd, or they produce the repeated infection, sometimes recurrence infection. For miscellaneous pathogens, they rarely cause the disease and very few animals are affected. Apart from the bacteria, there are other pathogens are there, suppose fungi, yeast, and algae. And fungi, Aspergillus, yeast, candida, Saccharomyces, and Protozoa like algae. they also produce the imperfect incident in the case. And it is quite difficult to diagnose such type of mastitis. And viral disease more directly, they directly do not responsible for the mastitis, but as secondary reason, they produce the mastitis. Suppose if you have seen any farm is affected by the FMD outbreak, the post-FMD cases, if you after recovery of the mastitis, some animals definitely suffer from the internal mastitis. So these are the they do what the mastitis in the as a secondary, not directly they are the mistake. Then clinical signs also differ based on that form of it. So what kind of diseases are there? They may be paracute, subacute, subclinical, or chronic. So in case of subclinical mastitis, what I have already told that subclinical mastitis, in case of there will be no any evidence of influenza, no any morphological changes of the udder, no, you will not get any physiological changes of the udder. Only there is an increased number of the somatic cell count. Somatic cell count. Now, what are the somatic cells? Somatic cells are these are the cells which are infiltrated from the blood during the process of milk synthesis. So, this type of cell, what kind of cell? These are the cells are the mostly neutrophil or polymorphonuclear cells, then macrophages, lymphocytes, and epithelials. These four group of cells are collectively known as the somatic cells in the body. And we know what is the threshold level of the somatic cell that I will tell in after slides. And what this level of the threshold of the somatic cell. Suppose in a normal way, there must be remain certain type of somatic cell. So what is the level, threshold level? This depends on the species to species. Then subacute mastitis here will be mild inflammation will be there, not that much severe inflammation, but persistently will remain abnormal in consistency, color, like. In paracute mastitis, you will get definitely a severe inflammation, systemic reaction, heat or pain on the udder, or udder may be redness udder will be seen. And systemic reaction means there is a high rate of temperature, having a little bit of heat. If the cattle buffalo are affected, then they may be the ruminal atony may be there. So these are the type of systemic reaction, and this is probably severe from mastitis. Then abnormality in secretions, what kind of abnormality you can see? Secretion means milk. What is the abnormality in milk you can get in the course of the different type of mastitis? Suppose you have this color, white color will change in the presence of the past or blood. Then presence of crop, you can get, if you check in the milk palm, then you meet the crop. Plaques, past, blood. Then these are called collectively known as the abnormality in the. Then other abnormality, what kind of abnormality? Just abnormal site. This means site, one side, support left side, other maybe large number of large, right side of other maybe small side. If there is a chronic mastitis, fibrotic mastitis, or chronic mastitis, then other side will be reduced. Or when there is acute inflammation, the other side will be. So abnormal site, consistency and temperature of the mammary gland. If in a paracute form of mastitis, acute mastitis, then if you palpate the udder, then you feel it is hot. Then systemic reaction, I have already told, fever may be there, toxemia may be there, ruminal atony, depression of animal, tachycardia, incumbency, anorexia. This type of systemic reaction occurs in case of paracute mastitis caused by the acute staphyl mastitis, acute coliform mastitis. Then clinical signs also depend on the type of the pathogen. This is also depends on the type of support. In case of coliform mastitis, then we can see the short-term clinical or subclinical. Clinical mastitis will be short. Step or Staphylococcus dysgalaxia mastitis, then recurrent clinical mastitis. Once you will treat the cases and then recover, but after that animal will again it will show down. Then Staphylococcus dysgalaxia is the persistent clinical or subclinical mastitis. This type of mastitis is quite difficult to treat the cases. For most of the cases, antibiotic remain. So these are the different type of clinical signs of the mastitis. In case of mastitis intramurine infection, if you see the if you examine the animals in the udder and animal is suffering from mastitis, you can easily diagnose the mastitis, checking the milk or udder. But problem is the diagnosis of the subclinical mastitis, because subclinical mastitis, I have already told, there is only the evidence of the number of somatic cells, increase of the number of somatic cells, and another thing is the reduction of the milk. So these are the salient pillar in the production of the enzyme or meat production. So pathogenesis, this is a very theoretical aspect, but very short I can first about the invasion, infection. Invasion means movement of the pathogen from exterior teeth area to the teeth canal. Suppose I have already told the contagious pathogen. Suppose contagious pathogen, the pathogen may be taken or environmental. When they remain in the environment or couch or in the surface of the couch, but when they get the opportunity, they enter from exterior teeth area to teeth canal. And after entering into the canal, they produce the infection by multiplying rapidly and produce the invade the myoepithelial cells. They will invade the myoepithelial cells and multiply. During the multiplication, they produce different type of toxins. Suppose it is caused by if it is caused by the gram negative bacteria, they will produce lipoprotein. If it is caused by the gram positive, then they will produce the echoic acid. So this type of pathogens will produce the different type of, they will invite the different inflammatory cells in the milk cells, milk compartment, and they damage the myoepithelial cells, and there will be interfere in the milk results. And different type of pathogens, cytokines may be produced, cytokines storm may be there, then they will put the system results. So this is all about the pathogenesis of Mastitis. Then diagnostic approach, what is the diagnosis? There are a number of tests are available for the diagnosis of Mastitis. But for the International Dairy Federation or National Mastitis Council, they mostly give the emphasis on the three types of mastitis diagnostic approach, that you must know that what kind of three types of mastitis, then you can tell that it is a case of the mastitis. First is the California mastitis test. Number two, the somatic cell count of meat. Number three is the bacterial isolation and identification of the from the meat. So first, the California mastitis, which is called cow site, it's very easy to perform, and anybody can do this test in case of field misery. So, with terms of CMTB, and how we can prepare the sodium hydroxide, tripol means detergent, and bromofisol percol, and distilled water. Then you mix it, this four component, and make up to 100 ml, 800 ml of the, or 1 liter of CMTB again. Then you take the milk from the different 4 quarters. There's a right 4, right height, left 4, left. So 3 to 4 ml milk you take, 3 to 4 ml each water, and 3 to 4 ml CMTB in there, and mix it and make the tilting process. Then if it is a gel formation is there in any water, then it is positive mastitis. And based on the degree of the gel, suppose some samples may produce very mild type of gel, then you can keep with positive trace. If it is a severe, more dense gel, then it will be false positive, strong positive for pickup. So this is the different type of grading. So why gel forms occur? Because when we add this gauge in the milk sample, the milk cell count depends on the number of cells in the milk. Depends on the how much number of the somatic cells in the milk. If mastitis is severe, then more number of cells will be there. Then what's happened? This type of reagent, they disintegrate the cell membrane, and nucleic acid materials will come and they produce that. So if the more nucleic acid is found in the milk, then more they will be formed. That means they are in the mastitis. So this is the basic principle of the California mastitis. So we can do it in a cow side test, and this is a good test for the subclinical mastitis. Number two is the somatic cell count. Somatic cell count is that this is we have to measure the number of cells per ml of it. So here I have given the example for the microscopic method. Because microscopic method we can do in a laboratory very easily for the when if you are having the microscope. Suppose somatic cell count is methylene blue, ethyl alcohol, 1,1,2 tetrachloroethane, and glacial acidity. This is a commonly available reagent in the laboratory, and we can prepare 50, 100 ml of the movement dampers. Then what we do? We have to be in a slide. We have to take a slide. In a slide, you mark the area by the marker 1 centimeter square, and you put the 10 micrometer and spread it and dry it, and then you put this 10 and again dry it and wash under water. Step water slowly, dry it, and examine under 0.1 grams of the. So for counting of the somatic cells, we have to know the microscopic factor of the microscope. So how will you do microscopic factor? There is stage microslide is available. You have to see the diameter of the area of the microscope, focal length, focus area. Then by the radius and the area is calculated from this area, 1 centimeter fixed square, we have calculated suppose 10 micrometer. Then from that, this factor will be calculated. This is simple formula and suppose 14, 14, 7. Then you have to count the cell in the 30 feet, and this number of cells are multiplied with the microscopic factor, and whatever the number of cells are coming total, this is called the number of cells per ml of liquid. So this is very simple, and this is the different type of it's in the milk, pink and mastitis. When you see the number of cells, if the milk is normal healthy, 1, 2, 3, 4, or sometimes 1, you may not get any cells like that. So in this field, every field, 30 feet you have to calculate like that, and you have to multiply by the this microscopic factor, this microscopic. Then you will get the number of cells. So somatic cell, what is the threshold level? Threshold level of the somatic cell is cow in the 2 to 3 lakhs per ml only. Goat 10 lakhs per ml. Sheep 5 to 10 lakhs per ml. Near 100 to 250 into 10 to the power 3 cells. Pig around 20 lakhs per ml. So these are the threshold level. In case of cow, 2 to 3 lakh in our country, we can consider, but in those developed nations where the dairy industry is so much developed, suppose European dairy house or American dairy house, they generally maintain up to the 1 lakh of cells per hour. If their somatic cells, they are so stringent for the other health, for the maintaining the good other health. In that country, if they produce the milk, if the somatic cell counts are high, then their milk rate, price of the milk will be decreased. So this is one of the important criteria for the quality of the milk. Then isolation of bacteria. Suppose you have to collect the milk and you keep here it also you can prepare in the laboratory if you are having then we are and so many other media are there for different type of bacteria. But these requires a one bacteriologist or any bacteriologist that can diagnose the pathogen. The pathogen isolation is also important. If there is one laboratory may be there in the bar, then if you know the pathogen, at least you can identify the gram positive, gram negative. Then it will be easier for the clinician to select the what kind of antibiotic you take. So, if you get gram positive, then you will go for the penicillin. Or you are the gram negative, then you can go for any drugs that come into it. Until unless you can isolate the bacteria or culture, then you have to blindly use the drugs. So these are the 3 types of tests. Then total bacterial count you can do for the standard plate count. You take the meat, you go for the sterile solution, NSS or TPS, serial dilute, tenfold dilution, and the final dilution you strip the in a plate and you count the same for following count and you multiply the dilution factor. Then you will get the what are the number of bacteria part of the meat. So this is used for the those who are involved in the research purpose, not for the field purpose, because it is not possible in case of field conditions. So these are the whatever I have put, helicodium mastitis, somatic cell count only, and bacteriology of the meat. These are the 3 classical tests are required for the diagnosis of mastitis, and these tests are recommended by the international dairy federation. So if anybody, a researcher or any scholar want to do research on mastitis, they must do 3 type of tests if they work on the mastitis, the large. Until unless these 3 type of data, the 3 type of tests can show the authors or research, then in that case, their publication will be quite good. Then different type of other tests are there, suppose 40 tests. 40 tests is specific for streptococcus agamicus. Streptococcus is one from the molecular part for this one. This is the process to the nuclear meat. Then also promotional purple test are there. This is the pH indicator. Then N-acetyl beta glucosinolated nuggets concentration you can measure in the milk. Nugget source of the nugget is the leukocytes. So if the milk is leukocyte infiltration more, in case of mastitis, milk cell infiltration will go. So this type of cells will produce more enzyme. So in case of milk, in the milk, so the high concentration of the N-acetyl glucosinolated, then you can say that this milk from mastitis. Then other different tests estimation of lactose, determinants of pH, milk catalyst test, electrical conductivity test, chloride test, two different type of tests are there. Then milk differential lymphocyte count you can do. Milk differential lymphocyte, if you slide of the milk, then you will get the neutrophil or polymorphonuclear lymphocyte. If you estimate the ratio of that in case of mastitis, then their neutrophil number will be. Then high mass diagnostic test. This is test product of different gram per kilogram. Then different estimation of different type of enzyme you can do, lipase, lysozyme, plasmin, bacterium, bioparasitic, cytosol, lactose. Because these are enzymes, something enzymes are secreted during the infant, some enzymes are secreted by the leukocytes, some molecules are secreted during the inflammation host of the body, active proteins, like that. So these are the different type of other tests are there. Mastitis. Then, so these are all about the mastitis and ELISA. Even various ELISA also available for the pathogen specific. Suppose we want to inject or screen the staphylococcus aureus mastitis in the heart. So staphylococcus was specific ELISA. But these are very costly and not feasible. Then on therapeutic and control, therapeutic control, there is the principle here, mistakes. I am talking about, not talking about a single mastitis. I am talking about the mastitis whole are. So there are the three principles, basic principles are followed. First is the elimination of the existing infections. Suppose at this point of time, if you visit any dairy farm and if you get suppose 5 to 10 clinical cases, so first is foremost target is the elimination of the what is the internal infections there, what are the animals suffering, you treat. So by the antimicrobial therapy, by treating the infection, or even in cases there which is not responding to any antibiotic, so immediately you have to calm down. Otherwise, they will be reported. Number two principle is the prevention of the new. And that means you have to prevent any introduction of the new internal infection in your heart. So this can be done by pre-post-peak dipping, proper breathing practice, environmental or nutritional management. Like then monitoring of other health status monitoring, you have to in a heart. If they support animals are very highly lactating animals are there or high in the animals, so you have to check the milk period. So here we can have a hard health status we can do by the seeing the level of the somatics in the bulk. Suppose annually when milk collection is going on in the morning by taking the whole milk of the whole animal. So the pooled milk support you have to collect the milk with the somatics. If the number of the cells are more in the pooled support, then you can see mastitis infection is there in the heart, or there may be any chance there number of high number of things. If the somatic cell can be under control, that means your heart is under control. Right? But here we are repeatedly I am talking is somatic cell count. What is somatic? Why I am taking? Because in case of healthy meat also, there should be some number of the somatic cells. Otherwise, animal will contract infection immediately. Because in the somatic cells, you will get the macrophage, lymphocyte, these are the immune cells. So if the number of cells is too low, then when the pathogen will enter, this pathogen can easily manage. If the number of cells are standard number of cells are maintained in the meal, then what if the pathogens will be enter into the meal? This cells will kill the pathogen by the pathogen. So certain number of cells must be there in the body. Then line of treatment, then what is the line of treatment? Suppose it is the animal is suffering from the staphylococcus aureus. So in initial discussion, we talked about generally the staphylococcus or coliform is produce the acute type of infection. So in that case, apart from the abnormality of the milk and other, you will get the high rise of temperature or systemic illness. So in that case, taking also so that type of symptoms should be targeted, for the effective. So in that case, you should start with the non-steroidal and NSAID, support meloxicam percent, chlorpheniramine preparation, or other anti-inflammatory. Then you have to give the inflammatory infusion of the broad spectrum antimicrobial. Because initially, if you don't assume that it is perfect step, then you have to do internally treated because then at the same time you have to do parenteral inflammatory infection with the Stephen Gordon to the crystal infection or amoxicillin sulfate. In that case, most preferable route of administration intravenous because in lactating animals, when the intermediate infection here, until the milk is properly evacuated through and the distribution will not happen. That's why intravenous preparation in both. Then you have to give some hospitals if the milk injection is not proper, then you have to evacuate the milk proper. Until the milk is evacuated from the infant or mastitis, the blood distribution will not be proper. So whatever the internal infusion you give, this is not proper. So this is the point to be important when we treat the cases from mastitis. You have to convince the owner or the livestock owner or farm manager that before internal infusion, milk evacuation is very much critical. Then generally happens sometimes in chronic cases they put the gangrenous spot, gangrenous mustard. So surgical amputation will be to reduce to prevent the toxin. In coliform mastitis, again same type of treatment, but initially then frequent involvement. Then in case of some animal off feed or high system invasion, then you have to give the isotonic solution. Otherwise, animal will go for the incumbent conditions or anti-inflammatory. So this is the different type of line of treatment. That means in case of mastitis, this or acute mastitis, only inflammatory infusion of the antimicrobial that will not solve the purpose. You have to put systemic as well as internal. Apart from this, you have to provide some supportive therapy, multivitamin. Then only the mastitis will respond to that. Another is the mycoplasma, so you can go for the oxygen. So based on the pathogen type, you have to choose the some type of fibrosarcoma. Treatment of fibrosarcoma, if you use the agents for different type of pharmaceuticals, they generally claim that we are having percent of nutrition or we can because generally fibrosarcoma, though they are claiming, but it will not respond to anything. Once the agar is fibrous, these animals should be treated with carbon. They are no homeopathy, they are claiming, but I did not find any substantial improvement by that system. Then environmental management, how will you do the environmental cleanliness, support cleaning is important. Proper milk removal, when you are making the animals are making, total evacuation of milk. That means if you not remove the milk properly, if the milk is accumulating the other day by day, then this is a good idea for the bacterial. So that's such type of animals suffer more. Tube dipping, 0.25 iodine, chlorohexidine, vanillin, glycerin, 4% sodium hydrochloride, this type of preparation there. They are tube dipping. That means after before pre-tube dipping, pre-tube dipping, you have to put some mild disinfectant, then clean it, then in the milking. After milking, you have to go to dipping, like a tube dipping car there. So you have to put this car with this solution of the other, and you have to keep for 2 seconds. Then dry cow therapy for long acting antibiotic, for long acting antibiotic, we are using long acting dry cow therapy. At the end of the milking, the last day of the milking, then we have to keep some long internally dry cow therapy, so that they can prevent the infection in dry. Then antimicrobial therapy, both internal system, and you can keep some nutraceuticals, support vitamin B, selenium, vitamin apart from zinc, copper, iron, zinc, copper, selenium, these are precursors. Then systemic acute coliform mastitis and this type of symptom are already. Then other abnormality of other on milk, apart from the mastitis in general, some other abnormality is also seen. Suppose simple, if you give the higher animal in the first milking, you will give when they remove milk from the udder. sometimes the milk get the blood, but there is no symptoms. So in that case, it has been seen sometimes capillary bleeding of the condition of the udder, because in the initial stage of the lactation, this capillary udder or myocapillary fluid, they become fierce or blood, sometimes oozy. So in that case, blood is being taken. So in that case, you can do calcium 3%, calcium 3%, parental and stethoscope, some maybe some side reduce the connection with the suspect. Then another is the idiom of the idiom. Sometimes in farm, some animals carry their other beaks. This is the other wording. So in that case, also caused by the other condition of the other or improper milking. Suppose milk is accumulated day by day, then there is another chance of them. So in that case, acetate fluid side. Another is the milk drop syndrome. Sudden drop of milk is generally caused by the leptospirosis. So in that case, you have to give some antibiotic to that, or you can check from milk by the leptospirosis. And then another the milk head depression. Sometimes animals are very high in that, or some also exotic. Generally, fat percentage more. Sometimes you can get low fat percentage. This is due to the fruit fiber. It is due to the result, dietary. So you have to enhance the fruit fiber from sodium bicarbonate certain percent. Then this may be then intrammammary infusion. Then what is the intrammammary infusion procedure? Procedure at first this is the intrammammary and when the before the infusion you have to read this will be evacuated. So after evacuating then you with the intrammammary. So here if the 4 quarters we have 1 quarter in infected, 3 are healthy. So this principle of the internal first 3 healthy adults we have to in this 3 in the other we include clean the milk properly and the end of the milking go for the infected adult. Otherwise at first you are ending this adult infected and you will be healthy, then the mastitis will be contagious. So in that case, so this is the and this is the dragon. If this milk is not able to go through the blood will not be proper. This is the then one successful treatment of the clinical mastitis. This is the original case. This is the milk udder, we healthy udder, and when I examined first with inflamed udder, and when there is blockage of the milk, then you put the peak side, and you have to be ready. So in that case, then I prescribe for internal and the other parental. And we told the owner, morning and evening, you have to clean the udder properly. If the animal will not cooperate, it's painful. If the animal will properly clean, then you go for internal infusion followed by intravenous antibiotic. Then after that, after day 5, this will color watch. Day 7, it was quite day 10. You see, this is the molecular and this is the cell. So management of the mastitis or treatment of mastitis or success of the mastitis treatment depends on the how the milk is evacuated from the udder. This is the most of the animal or farm managers to do the internal infusion without it. So if you evacuate the milk properly, after that if you apply the intramammary infusion, then the success rate will improve. And another important thing that what is the reporting time? Suppose animal is suffering a mastitis, you are reporting after 5 days, then it may not. So it is then what happens when the treatment is given? Suppose I am telling the reporting time what's then it may lead to development of the abscess or infection of the pus. So this is the original case again. This is the other pass to delay reporting. You see, this type of cases are not only solution that removal of the culling. So when the other abnormal people is the fibrous other, this other fibrous tissue. There will be no intuition, know what treatment will work. Only culling. Then another is then mastitis control. The mastitis control program. These have been because this type of control program is recommended by the different type of research and development or various type of trials or management aspects. The National Institute of Research on Dairying and National Mastitis Control has recommended 5-point mastitis control. 5-point mastitis control program. These are targeted towards the contagious disease. 5-point highly successful for the contagious disease. Plus several plus obvious. This not कहाँ ले जा रहे हो और इसका अपडेट कंप्लीट then this is the environment. Then what is the 5-point mastitis control program? 5-point mastitis control program. First is the udder hygiene and proper milking method. Udder hygiene, when cleanliness of the udder is important. Pre-teeth dipping practice, post-teeth dipping practice, like that. Proper milking method, like just hello sir. আমি একটা ট্রেনিং এ একটা লেকচার দিচ্ছি দেওয়ার পর বলছি 5 মিনিট then what is that this is a 5-point mastitis control toward the contagious pathogen. So control of the contagious pathogens in case of heart. Then proper installation, function, maintenance of milking. It is very important for milking because in our country the number of such type of high dairy herds are very less or cheap, but mostly in the developed nations, they are having the very high number of the commercial dairy. So their milking equipment is very important, milking machines. So this maintenance is very good. Otherwise, these are the source of the infection. Then dry cow management therapy. I have already told dry cow management therapy. How you are preparing at the end of the milking, you have to put a long-acting antibiotic in or sometimes treat sealant. Then appropriate therapy mastitis cases in medicine. Appropriate therapy for mastitis. Then culling of the chronically injured. What is the animal chronically injured? They immediately should start. Otherwise, this type of animal is source of the infection. Because milkers will use this animal, after that they will touch the healthy animal. So they will help to spread the contagion. So this 5-point mastitis control program has been recommended by NRC, National Mastitis Control of the Contagious Pathogen. But apart from the contagious pathogen, environmental pathogens are also there. So what kind of what about that? How do we control the environmental pathogen? So then after that they feel that this organisms feel that there are 5 additional management practices which have to implement it for the control. So total 10-point mastitis control. So these 5-point mastitis managed basically they are used for the management aspect to control the environmental mastitis. So these 5 points and earlier 5 points, 10-point mastitis. So additional 5 points maintains the appropriate environment. Good record keeping. Good record keeping means animals mastitis for production rate. High injury, they have more chance of mastitis. Or what is the frequency of the mastitis? What if the animal is suffering from earlier mastitis? Then monitoring of other health status, whether other immunity is proper or not. Periodic review of other health management program and setting goal of the other health. That means you have to set the goal for which part. That mastitis infection should be less than 2%, not 1%. Then we will put. So based on this, the National Mastitis System, they have recommended total 10-point mastitis control program for the effective management or control of the mastitis for the next quarter. Then prevention, for milking procedure, what kind of sanitary milking habits, clean milking, then other washing is important. Other washing should be done clean and fresh water. Then for milking, you have to remove the core milk. Initially, before milking, actually, you have to some amount of few drops from milk into discard. Then what is the bacteria that eats at the healthy? Then milking sequence, some healthy cow expert milking extra to go for healthy. Then other measures milking, post-milking, teeth dipping. Post-milking, teeth dipping is very important. We can reduce the 50% risk of disease. Mostly iron. Non-chemical based post-teeth dipping solutions are there. Natural products. Now, It is all about the mistakes. Now I can few minutes I can why antibiotic therapy is something thin and what is that different effect. Only mostly we know that development and antimicrobial resistance is the only culprit of therapy mistakes. But apart from the antibiotic resistance, it is right, it is 100% correct. But apart from that, there are different other factors of that are also responsible. Suppose whatever the bacteria is present in the udder or memory, sometimes they remain in metabolic state. These pathogens are less susceptible to that. You are giving the good antibiotic. It is drug tolerance resistance, antimicrobial destruction, sometimes the pathogen requires a dependent chemical that destroys. Intracellular leukemia pathogen mostly support staphylococcus, E. coli. Here come remain mostly intracellular support. They remain inside the pathogen, inside the nucleus. So drug distribution increases. So this is the problem. Intracellular. Then ill form of organism escape from antimicrobial effects totally, sometimes they escape adverse effect by immune cells, they kill the drug, sometimes they decrease the immune cells, phagocytic activity. Short-lived memory gun, sometimes some pathogens remain short in the environment for effective action of the antibiotic. Improper physical obstruction, support terminally support stenosis. So then drug will not be produced. The milk is passively in drug distribution. The necrosis of the memory, some focal necrosis in the memory drug distribution or cannot proper or antimicrobial cannot work properly. The infection in deep canal also another reason. So these are the different factors why the antibiotic something fits in the inflammation. So latest development, what are the other therapies support homeopathy from literature? We are oxytocin, suppose they are telling the oxytocin and these, but there is a problem in the oxytocin, and ozone therapy, they are some herbal intermediate STR, intermediate person, natural product. Then we prominent cytokines, lactoferrin, bacteriophage therapy, bacteriocins, then vaccine, J5 vaccine, E. coli, J5 vaccine. These are the other vaccine development expert in the mistake is taken very difficult because these are not called to the single test. There are a number of pathogens are there, and you cannot know, you do not know which type of pathogens are current mistake. So in that case, it is very difficult to the mistake vaccine development covering the whole pathogens. But vaccine, J5 vaccine, mostly E. coli vaccine, I have seen in the in the university one very hard. They are using the J5 vaccine because in their country, their E. coli mistake is even not it's not common. Once the E. coli is detected in mistakes, then they immediately move. But sometimes antibiotics not work. That's why to tackle this situation, they generally use this E. coli vaccine. So these are the all about your mistakes, control defense and treatment, and some aspects of hardened some purposes, other than right of internal nutrition by antimicrobial on the last day of the medicine. Last day after milking, suppose today this is the last day. So after milking, we have to do the internal nutrition to take exercise. That is that. So in that type of no accident will other even some already told you, even you make a parliament, you are to benefit this. Then depending on vaccines and severely that or cattle suffer food and non backward. It's a lot. In a dairy hut, we go for A20, which is then in the sheep, blackwater also sometimes. Then pig, in case of pig, three type of vaccines we give: swine fever, A20, and porcine sickness. PPR, both pox in the sheep and pork farm. Rabies vaccine can be used. Then vaccination schedule of the canine, if anybody knows canine vaccination, they can follow. It starts 6 to 8 weeks of age. So it start 1 week. Rabies again start 3 months and start 1 month. Then both the vaccine and complete operating process. It's a pure process. Parasitic is a canine are produced and are short. Hello.
Thank you, Dr. Udhu, for a
Thank
very nice presentation. Yeah, so I would like to invite the participants if they have any questions they can ask
Yes.
Dr. Day directly. Particularly the therapeutic aspect was covered very nicely and it must have helped.
Or you can write in
many
the chat
participants.
box. Then I can.
Yeah, they can write also. Any participants, if you have any questions.